Okay, part two. So I was talking about make sure you know depression. And let me be more specific. Make sure you can recognize the symptoms of when that depression is starting to lift, when the medications that patient's getting is actually starting to work. So, for example, if you get uh, patient that their family promised to come visit on this certain day and the family didn't visit and they get real upset and they throw something against the wall, what does that tell you? That tells you that the medication's working. Well, what do you mean, Professor D? Because when the patient's depressed, they have anger, aggression turned towards self, right? But as they start to see value in themselves, when the family breaks the promises, because they see value in themselves, they'll get upset. Where before, if the family didn't visit, they didn't care because they didn't think they were worthy enough. So make sure you understand depression and the signs and symptoms when it's lifting. Make sure you know your SSRIs, you know serotonin syndrome, you know your MAOIs, you know the foods to avoid. When the patient's on MAOI, stay away from tyramine. Make sure you know your hypertensive crisis. What else? Make sure you know your lupus nursing interventions. Make sure you understand how hard it is on the kidneys when you're going to teach a patient with lupus. Make sure you know Addisonian crisis. You can recognize if the patient's going into Addisonian crisis. Make sure you know your pediatric milestones. For example, 1 year old, the child's going to be on gallon milk, not non-fat. They need that fat because it's a time of rapid growth, so they need the fat. So not non-fat. That 6 months, you expect their weight to double. 1 year, you expect that weight to triple. 3 years old, you expect them to be able to ride a tricycle. Make sure you know the different plays, such as parallel play. Make sure you know Kawasaki disease. Make sure you know strep, pharyngitis. Make sure you know what can happen if that strep pharyngitis is not treated. The patient does not get antibiotics. Sickle cell crisis, stroke, dehydration, and pain. Make sure you know the difference between placental abruption and placenta previa. Oh my gosh, I think I'm going to have to make a third video. Make sure you know that medication, magnesium sulfate. And let me say this to you. You're not giving magnesium sulfate to decrease the blood pressure. Yes, magnesium sulfate has a side effect of decreasing blood pressure, and that is wonderful. But we're not giving it specifically to decrease blood pressure because there's so many better medications on the market without half the amount of adverse effects that magnesium sulfate has. So make sure you know magnesium sulfate for eclampsia. I'm going to have to go part 3.